welcome back to the Crooked Spine Show. Do you have mid-back pain, especially as we come out of this pandemic, hopefully? A lot of us had sit way too much the last couple years. Because of that, our upper backs, our shoulders, our necks, even our lower backs have become sore, tight, uncomfortable, even chronically where the pain won't go away. Because of that, sometimes you can feel more stressed. That can lead to anxiety, even depression over time. We choose not to do anything because it hurts too much. That is not a way to live a quality life. In this talk that I gave you certain exercise, how to get out of that, the mindset too. So we walk through exactly how to stretch, how to strengthen and maintain that strength so your body can stay healthy if we have to sit for long periods of time or not, then have the endurance to do that day after day after day. So in this workshop today, we talk about certain exercises. We start out with posture. We start with how do we sit? How do we stand? How do we do a checklist of those positions for yourself? Overall, learning how to do it properly so your body can maintain a longer time sitting or standing and not be in pain. Along with what I call the pillow stretch, we get the upper back to stretch on the floor with a rolled up bath towel for a period of time with the arms above our head. And also the broomstick stretch. I've done several times other talks too. The broomstick stretch, so you stretch everything, the shoulders, the chest, the upper back, everything at one time. Watch that exercise too. And then also 3 shoulder exercises. This one helps your overall body lean back more into extension versus most of us are stuck in flexion or hunched over. The last exercise I talked about is a corner exercise. Allows you going into a corner. At that point, hold that position for about 10 seconds or so, leaning back, allowing your body to stretch those pecs and upper back, make things want to become straighter in a better straight or upright position, right? Enjoyed the talk, my friends. Going to show notes have all the highlights of the actual exercise times during the workshop, along with links to our previous podcast and also links to this podcast as a video. All right, my friends, have a good week, and we'll see you next week. Let's get started, because I'm on a tight schedule. They'll kick me out about 1 o'clock, so I want to make sure I don't turn the lights up on me, okay? This is our upper body, shoulders, our body to go here, right? Up straight, yep. Everyone's sitting up straight, right? It's here instead of where we want to go.
I know.
Okay, how do we work all these muscles back here to make them stronger, to make our body stay here? When I work with patients, they come into my office because they're in pain. I tell them when they're in pain, is a lot of it is how do we get our body, yes, out of pain, but also from out of pain strong so it can hold better position. Whatever your stress level is per day, and sitting is a stress. I worked with a family therapist this morning, and she sits in front of her computer doing telemedicine, teletherapy with her clients about 6-7 hours a day. Computer's right here. It's like this. So she starts like this, and all of a sudden, she's doing this. Okay? So how do we get our body to stay up here over time? By understanding what muscles to work on both sides of the neck, shoulders, upper back, even the chest too, to make everything want to stay stretched out here and open here. Our biggest thing when we sit, for example, sitting is more of what causes more people pain in the upper back and shoulders, makes the body want to hunch, is we want to make sure that our body is more upright. What I mean by that, when we're sitting, the key to this is sit on the first third of the chair. The first third, that's sitting posture checklist. Here, first third. Feet, if you can, basing your chair is there, more on the sides, and having your knees go below your hips. That allows your body, now your hips to stay more open in the front. Your back can now relax with a natural curve in the lower back versus being more with your feet forward, where now your back wants to curve like a C-shaped curve. My lower back curves backwards. The problem is when a C-shaped curve, what does my upper body do? It hunches forward also. If I get my lower back to lean forward more, so more into extension, they call that position, extension to your lower back, your back can straighten out. Your head can come back more over your shoulders here. And at that point, your body can stay more relaxed on your spine instead of making your muscles work here. And again, too, as a reminder, what I do is I shoot a video of this, put it on YouTube within a couple of days or so I can give you the video link if you want to watch that instead of just watching or just listening, whatever you want to do. So as a reminder, I always make sure people have that, if you want, to the link to the actual email of the actual talk itself. All right, so again, checklist for your sitting posture. First third of the chair, knees below your hips, feet underneath you, either on the side or in the front. At that point, your body stays more upright here So your back feels curved, your lower back feels curved, upper back feels straighter, and your head doesn't tilt up, but more translates straight backwards, more over your shoulders. Okay? How does that feel? Does that feel comfortable? Does that feel like your normal posture?
Except the shoes slip, so you have to do it so you don't slip.
Make sure you wear spikes on your shoes.
Yeah.
Or something with friction. Or some people do too is you take their shoes off and just use your normal bare feet.
Do you have your heels up? You're supposed to have the heels up?
I would, because that allows you to bend your toes more, so you go further back.
Okay.
Good answer. Good question. Good observation. Is having your knees further back allows your hips to clear more. At that point, when your feet are back, you'll be on your toes more, so have you better balance. This will teach you balance.
Actually putting your knees down.
Yep. Knees down allow your hips to open up. If my knees are forward, my hips will close, make my back want to arch.
Oh, because that's usually how you would be sitting, is like that.
So exactly, if I want to have better balance with my hips, I'm going to bring my knees forward or backwards and down.
And further apart.
Further apart. At that point, you allow, because I'm further apart because I have to go inside the chair. At that point, I'm bringing my feet back behind me, so I can be back on my toes. That's when I'm balancing on my hips, it's called these tuberosities on my top of my femurs, on my butt, versus here where I'm having to really scrunch forward.
I think it's very lazy.
Very lazy, right? But people don't know.
No, I know.
And part of it too is that our facial bones and teeth of our skull, our facial bones in our front of our skull, is a lot of the way to the skull itself. Because your teeth and facial bones are a lot of the way to the skull, it naturally pulls us forward. So we have to not only have to set our posture when we're sitting, but also now we have to make sure these muscles stay strong here. They have endurance, not just strength. So we're going to work now on the muscles that allow us to sit or stand better, to allow our body to stay back more. So this is our sitting posture checklist. Okay, we just talked about that. Let's do the standing one too. That point is kind of a review from last week. Take the camera out a little bit. You can see me because I'm famous in my own mind. Okay, so right here. Standing checklist. Very similar to the sitting one. We're going to worry about our heels first against the wall. Heels, hips, shoulders and head against the wall. Again, the back of our head, not tilting our head, looking straight ahead. We want to feel the pressure on the back of our heels or our shoes, back of our hips, right below the belt line. That's at least for me. And also the shoulder blades back here on both sides evenly. That point we're not tilting one way or the other. We want to make sure we're here where the shoulders, outside shoulders, touch a little bit too, along with the back of our head. People that lean forward, they'll say, I feel like I'm leaning too far back. Let me do the wall posture check.
That could cause off balance, couldn't it?
Mm-hmm.
Yeah.
But good. Again, you're a great observer of questions for me to bring up. Is if I lean back, I'm going to fall back. That means your body is used to this as your normal posture, as your straight in your mind. We have to get the body to shift this where your center of gravity is. If it's here, sitting or standing, back to here where we can stand up straighter, more on our heels over time, so our body becomes more upright by changing and staying here long enough, 2-3 weeks minimum. So now our brain can change your center of gravity. Does that make sense? To do this once, to sit properly once, is not going to do anything. But doing it over a 2-3 week period where we move this way too, we stand and move this way, taking steps heel to toe, allows your body to relearn where your body should be. Where you're going to feel off balance, your off balance feeling resets your brain because you're uncomfortable. We have to make the brain and body uncomfortable to cause a change.
Every day you're saying? Or
every day.
Oh, really?
Only days ending with Y.
Huh?
The days ending with Y, only those days. Okay, so every day. But that's the goal. Can we change our body by feeling uncomfortable so our body relearns to reset our posture muscles here? We make the muscles stronger over time, I think we'll talk about in a second. Then our body resets here to stay here. But this is hard to do if you have neck pain with this, standing up straight, or upper back pain. I'm going to give you a stretch to start doing first, get things to open up. The reason we stretch first versus go right into strength, because we want things to be looser first. If a muscle and joint is looser, it'll accept that better position better, Then once it's loose enough, or a longer muscle, or position of the shoulders, for example, to our upper body, then we can load that better position. If I load my body with strength exercises here, I'm just reinforcing this. We have to get this to transfer here first and then load here, so it learns this and keeps this better position. Okay, any questions about that? So position first, flexibility next, and then load to make it stronger to endure that sitting or standing or walking more. All right, any questions about that? That's why chiropractors always worry about posture first, because that's our goal. Get the spine to realign so your foundation loads you and keeps you here. Then we load and we stretch to hold this better position. All right?
If we don't stand up straight, is that why we end up with a curvature in the back, like some people?
That kyphosis they talk about here.
Oh.
Here. And when you have the kyphosis, it becomes more hyperkyphosis or more severe, affects your breathing. Now, when you come forward, when you hunch forward, your chest cavity closes in. That space for your lungs to breathe becomes less and less. Affects your heart rate. Affects everything. So now your body goes under stress to cause now you to breathe heavier because you can't breathe harder. Or normally. So we can get our body to, by doing this too, what happens? Lower back, now your lower back is too straight. Your neck becomes tight because you still want to do here, you don't want to do this. I had a lady come in a few years ago, 15 years ago. She came in not because she had neck pain or back pain, she just ran into people. Like this, she walked this all day long. This is her posture, we're walking. She just don't run into people. That was the biggest thing. She wanted to make sure she could stand up straight again. So can we change things over time so our body learns that better position, then maintain that? Okay, so first one I'm going to do, camera a little bit, is how do we make the body stretch in a better position so it maintains that? Okay? Let me go here at an angle. Right about there should work. All right. Okay. Floor exercise. I brought my fancy mat. Okay. I think Costco 10 years ago probably, I'm not sure. So I'm going to go here at an angle so people can see that easier. What I'm going to do is get my body to extension. But I want to be able to relax at better extension, so I want to do it lying down when I'm relaxed. That allows my body to actually want to become more of a ligament stretch than a muscle stretch. If I stretch standing up like this, those are muscle stretching dominantly. Okay? If I stretch lying down, then my body, now muscle relax, the ligament has to control bone motion. The ligament between the bones allows the bones to move easier. Let me demonstrate so you can see it. With both my roller, fancy roller, and not so fancy towel. Simple towel. So I'm going to put a towel. This is called my pillow stretch for my patient. Pillow stretch. I'm going to put that towel right there. I'm going to sit down first here. And then here, I'm going to put that towel right about the height of my top of my shoulders back here. Okay? The reason is, I'll show you in a second, I want my head to fall back behind the towel. So I'm going to go right here. And here, and fall back behind the towel. So I'm more like this.
So the shoulders.
Exactly. So it's on top of my shoulders. I'm going to start with this first for maybe about 30 seconds. And from here, what I'm going to do is, if it feels comfortable, bring my arms over my head so the thing relaxes in its better position versus being more stretched itself out. So here, in step one, I'm going to get my head behind my body, allow the neck curve to form more. In step two, with my back being now straighter because on top of the pillow, my back to open up and stretch. Get those bones to move. It's called decompression of the upper back with the neck combined. Bring my arms above my head. When we can arch anything back, think your low back or neck, then our body can actually shift and open up, allow the bones to open up and then move in better position, better alignment, better posture to stand up straighter. Okay? Any questions about that?
See exactly where you're
Okay. So right about here.
between your
Right about here.
All right, between your shoulder blades.
Shoulder blades. Right about that. Not my neck.
Same thing with your pillow at nighttime when you're going to
I wouldn't because you want something hard on the floor, because the floor's going to push back on you. The bed, you're going to kind of sink itself.
You're pushing back on the floor for...
And this might be too much for somebody. You can do is take the towel and fold it up. Watch my folding skills, people. Okay? Fold it instead to make the towel more flat if that's too much pressure. Alright, so I'm going to go here again with a towel flat, lay on my mat or my floor at home, and up that to the top of the shoulders, then come back again.
Lazy, get away from us.
As a modification. If you want to be aggressive and really stretch out your back, if you're a yoga instructor or an acrobat previously, retired acrobatist, they call them that, use even a roller.
Oh, wow. That looks like it hurt.
Let's try it. Anyone want to demonstrate? Anybody? You're all saying no out there.
No, it looks hard.
Sad.
Too hard.
Sad.
I
Take that roller, put it on my mid-back, let it sit right there, a little higher. There, I'm going to go here first.
you're rolling it.
Let it kind of sit where I want to sit.
Oh, you're getting a massage.
And from there, I'm going to do is let my head fall back.
Oh, boy.
That feels good. I'm going to do now with my arms above my head. All right, so it's what you want to get out of it. You want to hold about 30 seconds, start 30 seconds, and from there build up from 30 seconds to about a full minute. And only once, all you do is only once. My stretching routine, mine is in the morning before I even have my cup of coffee. I want to stretch everything up. Okay. 30 seconds and then a full minute once your body's ready. And again, it's going to be a minute here, or 30 seconds here, then 30 seconds with your arms above your head. Any questions about that one? Feel loosened up. They want to try it. Demonstrate torso. Not yet, still warming up. Still warming up? Okay.
It's too hard.
It is, this is rough, but not even this, if you want to try to tell, let me know too. I have people that come in and their back is very tight. They can do just a flat towel.
Yeah.
Or sometimes if they're too tight too, I'll just have them lie on the mat and just put their arms above their head. And that feels uncomfortable. And when we stretch things out, again, when we stretch things out, maybe on a mat with 4 other ones too, we'll go over, we want to feel uncomfortable to get a difference, right? We want to feel not painful, but uncomfortable so it feels different to cause a change in your body. So when I show someone a stretch, I want to see their face. I want to see if their face says, or is it like, no, it's okay. I'm like, oh, we're not going far enough then. Let's do more. Questions yet? Anything yet? These are our stretches. Okay, stretches, we go from stretches to what? Strength exercises. Okay? We're going to do once. This is going to be a combined stretch and strength together, being efficient. So this is going to be my broomstick stretch. Turn the camera on a little bit. Here. Back to our normal position, position 1, I'm going to call it. Here. Good enough. This one you may want to try. I don't know, it's kind of dangerous. So this is not the stick you hit people with, because that would be weird. Taking a stick, broomstick, anyone you want to use, this is on Depot. 2012 I think I bought it. I'm not sure. From my office. And take the stick, and then come all the way back.
Wow, that's hard to do. You have good range of motion. I can't
I
believe
practice
it.
every day.
Look at that. Look
Every
at
day I
that.
practice my routine every day. My routine is, I do 5 wide.
Wow.
At that point, have a little cup of coffee.
Is that
And then-
5 feet? Looks like,
This is maybe 3 feet.
oh, maybe I could do it with that white one.
At that point, I do a little bit closer after a cup of coffee.
I can't believe you could do that so easily.
But
Yeah.
I'll be humble. It took me 3 days to get over my head.
Okay.
I tore my left shoulder back in 2000.
Ooh, no, you
It was part of my rehab was trying to do this and starting with this.
Yeah.
You're going,
Yeah. I know.
not gonna happen. I went like this and all of a sudden I'm like,
Okay,
okay, that's it. We're done.
Well, even without it, just to try it.
Just you're trying to get the arms back, right? It's not easy.
Yeah, you don't even, not even, you know, just.
It's just setting it. So let's try it.
Try to stretch better this week.
Volunteers, come on up. Celia's brave soul. Brave soul. Love brave souls.
No, hands up.
So here, as wide as you can to the very edge,
STRETCH.
all the way back. Keep the elbows kind of locked.
Oh,
Back.
look at that. Oh my goodness.
And then come all the way forward.
Rubber man.
Right over here. Actually, let me face the audience there.
Oh, okay.
There we go.
Make a point of straight, your arms are straight.
Arms are straight.
Arms are straight?
No, I'll show you the modification too.
Okay. Ooh, yay. Oh my gosh, girl, you're doing it.
Good modification.
Okay.
Does that feel
Right
okay?
there. Oh,
Let's go a little bit lower.
oh my gosh, ouch.
Like the limbo for your shoulders, I think. The limbo, bring your arms up. Good.
She's young and she did it.
Now modification can be for you to get that all the way back, so relax for 1 second. One is have you try bringing your right arm up over your head.
Oh my
And
goodness.
then bring your left arm.
Oh.
Maybe after a shower and your muscles
Let's try
are
that.
pumped up. Might work.
Okay, now you have to,
Not a problem. I'll help you out with this.
okay.
So here we can do is bring that right arm above your head, all the way over. We're going to come all the way down now. All the way over.
Ooh, ouch.
All the way down. With the other arm, elbow straight. And now, look, I like it. Oh, you said it. Look, perfect. Back forward, back forward. Oh. We're going to bring your arm this way. And then when you come this way,
My
and then here this way. Oh, you're doing just fine.
Yay.
Just like that. Oh, almost.
Oh,
Oh, that's hard. That's hard, right? But for years of you can I practice, yes, coming back, but instead of dropping it here, go straight back this way.
Okay.
It's going to take time.
Out.
Yeah.
You may go, first thing you may go, okay, I'm going to go here, and I'm going to drop a little bit, I'm going to hold right here. And I'm going to come back forward.
Okay.
As 3 days later, you're going to go, man, this is so much easier.
Oh my gosh.
I hope so.
I'm 47, you know?
You're young.
I feel young sometimes. So again, demonstration of the full broomstick pass. All the way back, elbows locked out. Arch all the way over, touch your back and come all the way forward, same position. To position 1. Modification, if you have a left shoulder problem, tapping my left shoulder here. I think left shoulder, left shoulder. Bring the right arm overhead. Let that right arm come all the way down to your side. And then bring the left arm over.
And you bend your elbows.
You bend your elbow a little bit. Just a little
Do that
elbow.
one more time.
Sure. So if you have the left shoulder problem, you want to use the right side of the stick to come over your left side. And then come behind you. And you can either, this way you can either go reverse it, right arm back all the way to position 1. Or if you're comfortable, from position 1, with your right arm over your head to the very back, then take your left side and go all the way over.
PCP pipes.
Yeah, anything.
You have
Isn't that solid? You want a solid material? You get that shoulder stretch back
No, I
here.
guess you wouldn't.
Here. 'Cause if I do a band, it's going to kind of stretch itself out all the way over. The goal with this is to get that shoulder blade here to stretch backwards. Get your shoulders here, the shoulders here, the outside shoulders, to rotate backwards. That's when our body stays in extension. Again, first being stuck in
I think we should.
flexion the whole time. That's the goal of this.
Think
This is going to be a full shoulder. Some people go, yeah, my back is fine, my shoulders are fine. Oh, good. Glad it's fine. Let's try this stick. They go, oh, I had this injury from a long time ago. So now you're going to work on your weaknesses of your shoulder range of motion by doing them together. Okay? So if you have a back problem, either a back problem, shoulder blades back here. Use this real quick. Don't do anything. Back here. Some of you have a shoulder blade problem here, or shoulders out here or here. You're going to feel this stretch like that spot feels bad. That feels tight. Or if your shoulders are tight this way too, where your front shoulders are more hunching forward, where your pec minor muscles are on both sides, when you do that stretch to start, you're like, I feel in the front a lot. It feels real tight. Well, good stretch. Feels tight there. Good stretch. Keep working the muscle. Again, we want to be uncomfortable to cause a stretch, to make our body shift more before we start some strength exercises. Okay, any questions about that?
swimming. Thinking swimming.
Swimming's phenomenal.
Because it's warm and it's water. I think.
And it's range of motion, movement.
Yeah.
Just don't drown. Funny for you. You're fine.
And it's
Okay.
years.
So any questions about the stick, broomstick stretch?
Yeah.
Got it. Okay, anything you want to use, go for it. Another one, I apologize for this one. I heard on the way here, so I drank half my water bottle. So we're going to use weights now. to make your shoulders stronger. A little more of a stretch, but more of a shoulder strength exercise here. I want you to get closer. You can see me better here. I want to do is find a flat wall and 2 weights. Water bottles, any brand you want to use. I think this is Members Mark, which I think is Sam's Club. I don't know. At that point, take 2 water bottles, evenly weighted, not like mine because I drank off mine. Here, this is a 3 shoulder exercise. Elbows tucked in, and that's the key, elbows tucked in. So it's just the shoulder upper back movement, not your arm not winging itself out. Okay? Elbows tucked in. Bring your hands with the water bottles in them at 90 degrees with your elbows. And then from there, bring your hands out, horizontal to your elbows, come right here. Hold for a second, and come forward. All right? So again, elbows tucked in the whole time. Come all the way out. Hold for a second, then come in. And the goal is, I'd rather you, for shoulder range of motion, just come here, maybe part way, with your hands coming out, versus doing this, because that defeats the purpose. Work on your range of motion first. So here, that point, if that feels tight in your upper back or shoulders, then go right there, then go forward. You want to feel this here in your pec minor muscle in the very front, in your shoulder blade muscles back here. Because when you do this exercise, you want to make sure that those shoulder blade muscles are protracting in as you do exercise. So if you bring your hands out here, what's happening? The blades coming in together, correct? Yes, people are awake back there. Good. So here they come in, hold, and then come back in.
So the elbows are touching your body?
Yep, come on, I'll show you. Yes, other volunteer.
Okay.
Sucked in. Here. And then against the wall. And then here. And then go where you feel comfortable. Start over. Elbows tucked in the
Oh, that's what I'm saying.
There we
Is the
go.
elbows touching the body?
Elbows touching and head back.
And head back, okay.
Good. Now.
Head touching?
Yep, head touching.
Oh, okay.
And now come back.
Now. Wow,
How's
it's
that?
quite a difference.
Fantastic.
Have good posture.
Good.
Big difference.
We also, the wall is meant to help you build your posture
Yeah,
here
that's good.
with movement.
I
Move
feel
with better
that.
position.
It's very good.
Go try it. Try it over.
Okay. I like it.
Head back.
Oh.
There we go. It's easy to do this.
It's supposed to be touching the wall.
Exactly. Elbows
touch the wall?
the wall. Yep. And now come out.
Oh, okay.
That's harder. Hey, it's harder. So when we come out, where it feels comfortable, right? Only here. Up on here. That's it.
And we just
I don't know that it's comfortable.
It's uncomfortably good.
It's uncomfortable. But,
Take a step forward
okay.
and elbows tucked in. And
Elbows
do it one more
touching.
time.
Wow.
Pinch. There we go. Pinch shoulders together.
Really feel
Come
them
in.
pinching back there in the
Good.
back.
Pinch again.
Good,
There we go.
good.
Boom.
We've got to do all these stretching,
know.
strengthening. This strengthens.
Woo.
I can feel
It
the
strengthens
difference.
here.
It
And
does.
stretches here.
So that'll help our posture a lot.
I love it.
Thank
Oh,
you,
look at
thank
this. That was enforcement. Enforcement. Good job. That's number 1. We have 2 more people. Hang in with Sarah. This is a marathon. This is a marathon stretch. Okay. The number 1 is here.
Touching.
Boom, right? We're good. Okay. Elbows tucked in. Shoulder blades being stretched. That point, shoulder blades back here, being protracted in. Okay. Number 2. Now, elbows horizontal to your body. I think it's horizontal. Again, body against the wall. Now, what you're going to do is keep your elbows not moving. Elbows do not move. Not this. Not a dance or some chicken dance. We're doing here is coming straight back. Hold for a second. And come straight down. Okay? So again, elbows touching the wall. Not moving. Just rotating your elbows up. Hands come up horizontal to your body. Next to the wall. And then all the way down. Alright, who wants to try this? Anybody? Nothing yet? Okay, let's take a break. Intermission. Okay. So that's number 2. Any questions about that one? Does that make sense?
It looks hard.
Yeah, come on, let's try it. I know, the base. Like, why do I have to go up there? Why? Okay. So here, we're just so you see it, here, elbows locked in horizontal to the body, and come back where you feel comfortable, head against the wall, and come back down. The elbows up here. Oh, the face! That's the face.
You can tell the difference.
There we go. And then, and now come back. No. We're gonna come up to good.
I don't know what I'm doing.
Let's go show you. I'll show you.
Okay.
Here, and then come straight up. There we go. Is that okay? Good?
Oh, boy, yeah.
Oh, wait, be screw the water ball in. It keeps leaking. Come on. There we go. Better. We're losing weight over there. We're losing weight. So down. Here. And now here. Relax the elbow.
Are they up now?
Yep, you're good. Right here.
Feel it when you're doing it right.
No, I can't tell what I'm doing.
You're good. You'll see the video later. You'll be famous.
Oh, no.
There you go.
It's hard.
This is what you're doing.
I don't know what I'm doing.
You're doing fine. Here, and then right back up.
You keep the ball that way?
Just like that way. And back down. Oh, yeah.
It's stiff because we're getting old and not doing this stuff.
How's that feel?
That's why we got old.
It's not very nice.
Well, good. It's not very nice. Like it.
I still can't, but I can't tell what I'm doing.
You're doing okay. You're just exactly what you should be doing.
Okay, I'm done.
Thank you. That's not easy. That's not easy. Third one.
83 years old doing that.
83 going on 23. Good for you. Number 3. This is the more complicated, so make sure you pay attention. More movement involved. So I'm going to go here on the wall flat, correct? Now I'm going to shift my body, hips on the wall, feet off the wall, here. Now what I'm going to do is take those water bottles, put the water bottle so the top of the water bottle is facing forward. I'm going to bend my body forward a little bit. I'm going to come straight up this way. Hold for a second, and come back down. Okay, so I'm going to come up. And my goal here is to make sure back here, again, contracts together, but not down here as much with this one. Be more of up here in this part of the spine. I want to get this a little bit stronger up there. So I'm going to do again, hips on the wall, feet off the wall, maybe a foot off the wall. Body tilts forward at the waist. At that point, elbows or water balls pacing forward. At that point, I'm going to come and bring my elbows and my arms, arch them next to my head, hold for a second, and come back down. Okay? I'll show you the side view too. This is the wall behind me. Leaning forward. Bring the water bottles forward. Arch my arms up. Pinch the back of my head as my head's staying up. Hold for a second. Then come back down. Any questions about that?
You make it look so easy.
I do it every day.
You cut the arms.
Elbow slightly bent. Fully bent. Up. And then
I'm gonna do.
any questions about that one? My famous 3 shoulder exercise. Should patent it or something.
You're such a baby.
Exactly.
Saying you're 47.
I know, I am. I still take my Metamucil every day, just in case.
No.
Any questions about that stretch? I have one more if you guys are up for it. One more for strength of upper body and shoulders. Keep your body here. Okay? It's going to be a wide, let's do it here. It's going to be a wide wall push-up. Okay, the reason we want to go wide in a push-up is to make the blades back here come together, but with load of your upper body. So wall push-up, I'm going to do here. I'm going to go wide, take about 2 steps away from the wall, and lean forward just a little bit so I have some distance to work with. I'm going to come in, hold for a second, then push out. The goal again is to get these areas back here to move in. When these are strong, your upper back area, your rhomboids back here, that's when your body stays here instead of being here. Once the blades learn to stay out where the muscles are stretched out, they become weaker. This is what we do. Got to get them to come in, keep our body upright by keeping them stronger. Then our overall body, our bounce from front to back of our chest stays more open instead of being closed off. All right, so wall push-up again. Simple, simple. Hands wider than your shoulders. 2 feet away from the wall. Come in. Hold for a second. When you push back, breathe out. Push back with your breath too. Lock the elbows out for a second. Then come back down again. Hold for a second. And then come back out. Any questions about that one?
Would this be also be good for a rotary cup?
It would, because it's less load.
Ah.
Versus doing a full push-up or more weight, just your body weight. To make it easier on people too, what I have done in the past, turn this around so this doesn't block your vision. Corner of the room, there we go, ish. Taking a corner of a room, it's going to be hard because it's going to off a little bit. Here, using a corner of a room, and coming in, hold for a second, and coming out this way with your head up the whole time. So it's a wall push-up in the corner, or you're coming in, at that point hold for a second, and push out. Get more blade protraction and retraction, lift them even stronger. Some people use that more, it's a little bit easier for people. They have more range of motion too in the corner. You can stand upright and just push in instead of leaning forward, and then push out.
I'm so tired.
So tired of watching me do all the work. I understand. Wow. Questions? Look at the quietness. I answer
Every day.
only the days ending with Y. Only those days. Because we're moving every day. If I'm going to move every day, I have to make sure I'm doing enough to negate that stress in my body. Especially if I'm sitting. I'm going to sit for how many hours? Some people sit for how many hours a day? Sitting or driving. What are you going to do? We have to move to cause your joints to stay pressure, less pressure in your joints, most of the stretch so they actually have more flexibility. It'll move enough, we get tighter, we get tighter, we get tighter. Here, tighter. Stronger here. Motion, movement. Take classes, yoga. If there's still a dance class or a Zumba class, move more.
Here at this place?
I don't know, or the YMCA also too.
They're just doing a water thing, with
Okay.
your knees going up and down.
Yeah.
Thanks,
Lonnie, for watching.
It's going to come back,
Jason too.
but I got the teacher
And
section.
Well,
Reese.
talk him into doing senior yoga.
I'll talk them into it. It's all the COVID stuff. We have to wait till it clears. I just work. But these you can do at home either with friends or by yourself. And again, what I do is have the video online probably by tomorrow if you want the video. If you're not on my email list already, I can always give you have an email from you to put you on my list for the newsletter and also the video. So, any questions?
I have a friend who couldn't come today, but she does do, computer stuff. How does she have a card maybe
Yeah,
to give
I'll give you the
her
card.
and-
That point, I'll give you my card. That point, you can go on YouTube. It'll be on probably by tomorrow. I should have time to post it probably tomorrow night, so latest
It's the
Friday.
back that she needs the help.
So the back would be next month. Our back exercise
Right.
workshop is next month. Yes.
I've had some problems opening up those YouTubes,
Looking them up?
opening them up. I
Really?
can get a whole list of them, but I can't figure out how to open them, how to actually place them. Some of them are easy, you just push them in place.
Is it from the newsletter or is it from
From the newsletter.
the newsletter? On the newsletter, you have to go to the orange title. On the newsletter, where the orange title says, like, for example, exercise playlist.
Okay, yeah, exactly.
And then from there, go to that link. That'll give you the full playlist of that video.
Oh, yeah.
And from there, it'll give you, because then it'll go for read from there.
So the ones that you'll be sending are not part of the newsletter then?
Not yet, not until next month.
Okay, but you will be posting this one?
Posting this one in about 2 days.
Okay.
It'll be on there. Because YouTube's what?
And
Free.
there's only one there, so,
Exactly.
okay.
That'll be the new one. It'll be called probably Upper Back Workshop, Gibson Center, August 2021. A normal title, because I'm not very creative. Simple things.
Back.
Good?
Upper back what?
Upper Back Workshop.
How do you pronounce your name?
Ratkovic. Ratkovic, so silent T.
Rat, say that again?
Ratkovic.
R-A-T?
Ratkovic, but it's not in T though.
R-O-A-T?
On the flyer right there.
Kovic.
K-O-V-I-C?
Yep.
Rakovic?
Yep.
Rakovic.
On the flyer.
Rakovic.
Yeah. Ratkovic is the Croatian.
Oh, his name, oh, okay.
Yeah, that's the ethnic pronunciation. Ratkovic.
Okay.
One time my parent, that's just, yeah, you can .com if you want.
It's further my friends.
Oh yeah, it would be, I'll give you the card with the YouTube
Okay.
thing. But one time my parents were in Croatia and I was trying to talk to my dad about something about property or something.
Croatia.
Croatia, that's my dad's from Croatia.
Oh.
And I called over there in Croatia, I called the hotel and go, looking for Joe Rakovic. They go, Joe Rakovic, we don't have a Joe Rakovic. I go, give me 1 second. I'm looking for Joe Rakovic. He goes, oh yeah, Joe. I saw Joe last night. I'm like, oh good.
Everybody knows everybody else?
So you got to put a little dialect in there, the little slang that they have. So, the itch. So, questions? Good?
Thanks for being here.
It was fun. I had a good time. I don't think it entertained you guys. It's all more for entertainment.